Hello, everyone. Outstanding morning. And this is your Braveheart Netpreneur Show. And here we are. Once again, we are here for another live show for our women's health. And today, of course, we are having a very exciting topic, and it's all about women. Of course, before I will start, I would love to ask anyone who have not subscribed our YouTube channel, subscribe if you want to have more videos, and if you are following us, you can click the bell button so that you will get notified whenever we have a new topic or new video that are coming up. So, ladies and gentlemen, our topic today is a special topic that we will be discussing about women's health. And of course, I would love to share to you my screen so that I could show to you the topic that I will be discussing with you today. All right. So, actually, today is a day that I have no guest. So I have, because I have a special presentation for all of you. And of course, this is all about the women. So welcome once again to the Braveheart Netpreneur Show. Ladies and gentlemen, the special topic that I am talking about is the most common health issues that is faced by women of today. There are so many issues, there are so many health issues that all of us women are really facing. So that is the reason why I have thought that I will be having a discussion on these issues. Of course, I will be discussing few of them, which will be continued because about women's health is really very long. So we all know that women often spend so much time in helping others that they don't even take time for themselves. And that is really true by experience. I usually sometimes forget myself just helping others. And it's really good, or it's okay to take time to focus on good health. We need to be healthy. We need to have a good health as women. Of course, it's not easy to be having some illnesses, some health issues, especially when we are taking care also of our families, our children. So we have to take care of ourselves. Women face a range of unique health problems. That is really, really true. We have we are facing so many health issues sometimes that we don't even understand, or even our doctors don't understand, or they could not find any reason or whatsoever when we are not well. Awareness and advocacy for women's health is vital. That is to improve quality of life and, of course, wellness for women. Women's health is really a broad topic. As I said earlier, we have so many health issues that we need to know, to learn, and it's really very broad. And I have compiled, or I have prepared five most common health issues that we will be discussing today. And of course, number one is breast cancer. I know so many women who are suffering from breast cancer. I have experienced also during my nursing career, when I was working in the hospital, I've seen so many women are really having breast cancer, or suffering from breast cancer, or even dying from breast cancer. Breast cancer is the most common cancer in women. 500,000 of women die due to breast cancer each year. Imagine that. So awareness and early detection is very, very important. It can be a life-saving measure if we will recognize earlier, if we will find, or we will know, or we detect any early signs and symptoms. It can save us from going further into this health issue. And we need to know how to detect, or how to check whether we are having those symptoms, signs and symptoms that are already leading into a breast cancer. Or you can ask your doctor about mammogram. Mammogram is an examination for the breast in order for you to know whether there is a lump growing on that can lead to further uh, cancer. And of course, self-examination. Self-examination must be done every now and then. So there are so many techniques that we can learn. We will know how to check ourselves when, if we are having signs or lumps that it will be leading to breast cancer. And of course, we will discuss more on that, and I can give you some um, of these self examinations. There is a full program for that, that we can demonstrate on how to check the ourselves on ourselves, to have a self check for breast cancer, that is for prevention of ourselves. All right, so number two, this is the second most common to women, is a polycystic ovarian syndrome, or what we call in the medical term, in the short term, which is PCOS. PCOS, or polycystic ovarian syndrome. This is a hormonal condition that causes the growth of cysts on the ovaries up to 10% of all women of reproductive age, meaning that on the age of reproduction, we all have, or there are, the PCOS is very common, or the polycystic ovarian syndrome is very, very common. This this cyst can be painful and may also lead to infertility. So let us get screened, or we can go to our gynecologist for check-up when you are already having, especially when we are having advanced signs that we are feeling, especially pain during menstruation or before menstruation. Let us check with our gynecologist. So that is our polycystic ovarian syndrome. Now, the third one is pelvic inflammatory disease. This is what we call in short term, that which is PID. And PID is an infection. This is an infection of the uterus, fallopian tube, and ovaries. It is caused by transmission of bacteria. It's coming from our vagina, because that is the entry point of any bacteria that can go inside our cervix, or it goes to our uterus, and then it will transmit to the fallopian tube. And of course, that can cause, it will continuously grow when it's already inside our reproductive system, and it can cause infection of our reproductive system. A number of different bacteria may be involved, but the most common are infectious of gonorrhea and of course and chlamydia. These are very common causes of the pelvic inflammatory disease. Uh, PID affects an estimated of 1.5% of young women, especially with the those who are having an active sexual life. It will be very common, especially the with the young women who have already active sexual activities. So that is our pelvic inflammatory disease, which is it can cause us more damage if we will not go and check if we feel some of those signs and symptoms that is having that we already have. So number four are in endometriosis. This is another health issue that it is sometimes neglected. Endometriosis is a disease in which tissue similar to the lining of the uterus that grows in other places in the body. It is one of the most common gynecological diseases affecting 10% of women or 176 million of women around the world. And its primary symptoms include pain, and infertility. Endometriosis can be treated with medications and surgery. So this is very, very common also with women. But if we already find out that we have this problem, we need to go and check our doctor so that we will not go further or it will not lead to any more damage in our reproductive system. Last but not the least is a human papilloma virus. Human papilloma virus infection. This is also an infection which is common also in sexually transmitted disease. This is another type of virus that is transmitted through sexual activity. So this is an infection often cause no symptoms. That is the reason why we neglect sometimes. It has no symptoms and resolve on its own. However, in some cases, it can lead to genital wart. Remember that, ladies. It can it can lead to genital warts and can cause cervical cancer if it will not be taken care. It will grow and it can lead to cervical cancer. Cervical cancer is one of the deadliest cancers for women. We have to remember that. Thankfully, there is a vaccination to prevent this human papilloma virus infection. Okay, so that can be given to adolescent girls and women. So those are the five most common health issues that women are actually most of them. Some of us we neglect them, or sometimes we don't even check that we are already having the symptoms, and yet we don't even go and check to or with our doctors. Overall, we need to take care of ourselves, and we have to take care, especially with our reproductive system, especially when we are having our menstrual period, and even every day we need to take care. We need to check, or we need to be conscious with our menstrual hygiene. This is very, very important part of women's health, and especially during the reproductive health, during the time that we are already on the active reproductive uh, age. We need to take care of our health. So poor menstrual hygiene, you see, poor menstrual hygiene is linked to various infections and reproductive illnesses such as bacteria, fungal infection, toxic shock syndrome. So menstruation is a sign of health. It can lead us into health problem if we will not take care. If we will not take care, especially hygiene. I know some women, they have belief. I heard some women, they have believed that they don't need to wash. They don't need to wash their private uh, parts when they're having menstruation, which is very, very dangerous, because that can attract bacteria or virus when it's wet there. So it can lead into infection that will go inside, or further it can go to the cervix, it can go to the uterus, and even affect our fallopian tube. So viral infection and virus infection are very dangerous in our health, so especially during our menstrual period. So we have to take care. So I would like to clear it again that poor menstrual hygiene is linked to various infection. That is really, really true. And reproductive illnesses such as bacteria and fungal infection and toxic shock syndrome. So ladies, so we have to really take care of ourselves, our health. And of course, these are all the 5 most common health issues that every woman are facing. I know there are so many more. There are so many health issues that we are having, that we are facing, and of course, one by one, we can discuss them on our next episode. And especially, I would like to give a little bit of advice or solution for us, in order for us to prevent all of this. We can prevent all of these health issues, especially if we take care of ourselves. And of course, one thing that is very, very important is we need to take care and check. After having a good hygiene, we have to check the foods that we are eating. All of those health issues can be prevented if our body is not acidic, because acid is the food of all those issues. Now, we have we are advocating for women. For if you are following my videos, I have talked about the 7 doctors, which we can also follow in order for us to prevent all of these health illnesses. If you haven't seen, or haven't watched, or haven't heard about that 7 doctors, 7 natural doctors, you can go and check on my videos, or I will put the link below, so that you can watch that and learn the 7 natural doctors and be healthy. Women, we need to be healthy. Women, we need to take care of ourselves. We want to stay longer. We want to live happier. We want to become healthy and be effective in all that we are doing. We want to enjoy life, of course. So we need to take care of ourselves. As I said, I would like to give you some more tips, which is clean yourself, have a good hygiene, eat all the good or healthy foods, drink a lot of water, have a good sunshine, have uh, good exercise, and of course, let us continue having an acidic body so that our body will protect, our immune system will be increased, and we will be protected from our from those bacteria or infect or virus that can infect us. So whatever we will do, let us make sure that we are living with the healthy life. So, ladies and gentlemen, uh, if you have some questions regarding health, I would love to hear from you. I would love to have your questions or answer your questions so that I can discuss more during our shows. This will be a regular show during Mondays, and of course, I would like to help more women. I because I am really advocating for women's health. I I have seen so many women. I have encountered many women who are having lots of issues regarding health. Let us work together. Let us help each other. And the only way that I know I can help you is uh, through this video or through my YouTube channel so that we can discuss whatever questions, whatever health problems that you are having that you want to ask me as a nurse. So, ladies, this is this is really very important, especially when we are already aging. There are so many health issues that we are confused of, because I have a friend. I have a friend who was not feeling well. Like she said that she's always having pain. She's always having lots of uh, when you are having those kind of pain that you don't even understand, body pain, abdominal pain, some of the symptoms. And then when you go to the doctor, they will do everything. They will do checkup. They will do all the laboratories. And then after all, they will not find any diagnosis. So maybe in my own little way, we can help each other to really find out in a natural way, so that we can help each other, so that you will find out, because as I said in my previous shows, that we are advocating for total holistic health for women. And of course, some of my friends who are already having the testimonies after discussing, after helping each other to find out what are those health problems that they are having, or what are the possible way of having solution for that, for such problem. So I would love to hear from you if you have questions, and of course we will be discussing it during my next show. So thank you very much. And if you haven't subscribed, or if you like this video, subscribe on my YouTube channel so that uh, we will be we will be meeting again. Of course, you can also click the uh, bell button so that you will be notified whenever I have a new video that is coming up. So thank you very much. And this is Nancy De Ocampo once again, your braveheart eagle. I am a nursepreneur. Thank you and goodbye.